Hi, everybody. My name is Gustavo Gonzalez. I am part of the D5 United Leadership Group here. And so with that, I'm going to pass it on to the new COVID Grassroots Outreach Program. Nora, you want to go ahead and kick it off?
Yeah, I'll start. Thank you. First of all, thank you for giving us some space to actually talk about the efforts and the grassroots project through the findings that we had put out. And actually were first released on May 10th through the Mercury News in an article that showed that the highest number of COVID cases were in 4 zip codes, which all reside in East San Jose, which is 95116, 95112, 95127, and 95148. And I share those so that anyone out there that is watching this will know that they are in a zip code that has the highest cases of COVID-19. And we have been able to partner with the county to make sure that we were able to get a pot of funding and resources that are being used to do a grassroots outreach. And you'll hear from Veronica and Reymundo later as they talk about what they're actually doing to get the information out. But I think the important thing to remember is that we're in a pandemic and we have pulled together as a community to make sure that we're addressing the needs of our community so that people are getting tested, that they're getting the correct information, that they're able to continue to work with the ease of knowing that they are not positive, and if they are positive, that they're getting the resources they need so that they can protect their family and their community. And those are the things that we have been able to do with the collective. And the collective is an organization that has different nonprofits that are together. And I know Veronica will touch on that as she does her presentation. But I'm hoping that as we collectively come together and we talk about what is happening in our community, that we're all speaking with one voice and being able to share the information abroad and across East San Jose, as well as the rest of the county. But it is so crucial that we are addressing this through the grassroots outreach. And one of the things that I just want to leave you with before I turn it over to Veronica is that if we are going to make sure that we get the resources that we need to help our communities and to make sure that we're helping our neighbors, is to collectively speak about what are the needs that we need here in East San Jose. And that's what we're doing, and that we do through this effort and this grassroots outreach program. Veronica?
Good night, good evening. Thank you, Nora, and thank you for all your advocacy. And so my name is Veronica Goei. I'm the Executive Director of Grail Family Services, which is a nonprofit that has been serving the east side of San Jose for more than 20 years. And so I have a presentation I would like to share. Is Reymundo start? Okay, so if you let me share a presentation, I would like to do that. Okay, so I would like to tell you a little bit, give you a little bit of context so that you understand who is the Si Se Puede Collective and what is this campaign that we are launching with our partners. So, you know, the Si Se Puede Collective is a group of 5 nonprofit organizations that are all serving East San Jose. The organizations that are part of that effort are Amigos de Guadalupe, Grail Family Services, the School of Arts and Culture, Somos Mayfair, and Vegilution. These organizations combined serve annually about 12,000 families from East San Jose. each one of those the organizations, we have a specific focus area, but we have come together, and we did this about 5 years ago, to collectively have more of an effective impact in East San Jose. So each organization has their focus. For Grail Family Services, is education, early care and education. We operate a family resource center. We serve several schools in East San Jose, as well as we operate 2 state-funded preschools in the community. So we came together with the idea that together we could effectively serve the community. When the pandemic hit, we were very concerned, like Nora expressed, that 3 of the zip codes in East San Jose are the highest, the zip codes that have the highest number of COVID cases. And so we were concerned, and I very much appreciate Nora's advocacy at the county level, and the supervisors are also concerned. And we all came together and said, well, what can we do? Because we cannot allow this to happen and really not do anything about it. And so we came together, and in partnership with public health and with Gardner Health Services, we launched what is called a community health worker pilot project and a grassroots public health campaign for East San Jose. And so I'm going to tell you a little bit about the components of that project. So the main goal of the project is really to reduce the disproportionate number of residents affected by COVID-19 in East San Jose by educating the community about the importance of being tested, about following precautionary guidelines to prevent COVID-19, and accessing resources regarding COVID, as well as supporting contact tracing that is being done by county employees. So that's really the main goal of the project. Give you some high-level highlights of the activities. So as part of this pilot project, we were charged to develop and deliver a training of promotoras and staff in response to COVID-19 pandemic. We just completed that training last week. We've trained 29 promotoras that are going out in the community to share information, to distribute PPE, to support the testing sites, particularly the one at the School of Arts and Culture, so that people are getting tested. And that also they're going to be creating an advocacy committee that would be talking to community residents and giving the county some feedback. So this group of promotoras that has been trained will develop an outreach plan in coordination with their agency, because each one of the 5 agencies has a number of promotoras that are going to go out in the community, like I said earlier, to disseminate information, resources in East San Jose, and also to provide the county with some feedback. Just want to give you some background in terms of like what we learned as we did the training. We surveyed about 100 residents, trying to understand the myths and fears that people have in regards to COVID-19, and not to our surprise, many of the things that you've heard through the media, that it's not real, that it's, you know, it's a hoax, that it's not going to happen to me, that it only affects old people. But I think we wanted to understand so that we could equip the promotoras so they could go out in the community and deliver the right information. All of the 29 promotoras that were trained are residents of East San Jose, so they know the community, and they will work with their agency to develop a plan of action to really make sure that some of these activities are happening. The total goal, the deliverable of this project is that the promotoras will serve about 2,400 families in East San Jose. At this moment, this is a pilot project that is going to last until November, with the goal that if things are, you know, really looking good in terms of accomplishing our goals, that the county will extend this project. Obviously, there is a huge need that the project goes beyond 3 months. There's not a lot that we will be able to do, but we'll accomplish some things. You know, in addition to information and PPE distribution, testing is huge. One of the things we learn as we train the promotoras is the lack of understanding of why do people need to get tested. And so if they didn't know that, now they know, and now they know what to tell the community and how to share that information with the community. So that's kind of high level, some of the highlights of the pilot project activities. And you know, kind of along the lines with that is like, what is the role of this promotores? So they call themselves warriors against COVID-19. You know, I wish, you know, I had some of the video that we recorded from the training, because they're very excited about the work that they're going to do. And I think it's critical. I don't think just having a testing site on the east side of San Jose is going to be enough. So having the ability to have residents go out in the community to deliver these messages, I think is critical to making some difference in terms of those numbers. In addition to the use of promotores and the testing site, we're also going to be using a parenting app that was developed by Grail Family Services, and we're going to reach about 1,000 users within those zip codes that have been identified for the project through notifications that will go out twice a week. And so people that have downloaded the app, which is free, by the way, so we're not trying to sell anything to the families. It provides information about parenting, and it's very useful for parents of young children. In addition to having access to the app, they will be getting notifications that will range from resources related to COVID-19, information related to COVID-19, reminders about being tested. So, I mean, again, we are trying to make this grassroots campaign have different fronts. The testing site, the promotoras, the notifications through a parenting app. Each one of the 5 organizations will use their Facebook page as well as their newsletters to promote information about COVID and you know, the content that was covered under the training. So, I mean, I know I gave a lot of information. I wanted to give some time so that people can ask me questions about the project.
Okay. So, Veronica, let me ask the audience, participants, if they have any questions, to please raise their hand, and then I will call your name, and then you'll be able to speak. And then once you're done, I'll move to the next one. So right now, let me check the participants. I do have Patty. Yes? Okay, Patty Henry has her hand up.
So
I'm
Gustavo, I just want to let you know that Reymundo is here as well.
Okay, great. So as soon as
Reymundo is here as well. So just to let you know that.
Thank you, Nora. Yeah, I could see him. So as soon as questions are asked of Veronica, we'll move on to Reymundo. Is that okay?
That's
Or do you
fine.
guys? Okay. Patty, go ahead and ask your question.
Can you hear me?
Yes, we could hear you.
I didn't know exactly what your format was, so I spent some time trying to figure out this part. Yeah, I'm kind of waiting for the recycle information.
Okay.
That's my main concern, but I really appreciate the information. I'm learning a lot.
Wonderful. Thank you for that.
And if I may, testing is going to be at the Mexican Heritage Plaza, which is on the corner of Alton Rock and King Road. And it's every Wednesday from 1 to 7 p.m. for the next 24 weeks. And we've already, it's 26 weeks and completed 2 weeks already. So I just want to give a time frame on how long it's going to be available.
Okay, so I don't see any other hands up at this point, so I'm gonna go ahead and have, oh, wait, Blanca has her hand up. Blanca, go ahead.
Yeah, hi. This is very, very informative meeting. I never joined you guys, but I love what I heard that you all are doing. And I just want to let you know that I wish I can have your information. So if you need any help, you can count on me. I have 2 hands and 2 eyes, and whatever I can do to volunteer to help in any way. Um, yeah, and if you guys can share with us the information, we have like 2 preschoolers, but as you know, this during COVID, the programs are closed or something. And if they are not closed, they are very expensive. I just want to know if there is any free programs for pre-Kers too.
So do you want me to answer that question or?
Yeah, please.
Yeah, please.
So at the moment, we are not adding to the grassroots outreach program a volunteer component, but I think that that's a wonderful idea. I have no problem if, I did send you, Nora, the PowerPoint, and if you want to share my contact information, and I'll refer it to my team and the other members of the collective, I think that it would be great to have volunteers, because it's going to require the whole community to really make a difference. So it's not going to be just the testing site, the 5 agencies, the 29 promotoras. It's going to be a lot more. And so I think that's a wonderful suggestion. In regards to preschool, Grail Family Services is operating currently the 2 state-funded preschool with limited numbers. I believe the one on Story Road has a couple of openings. If you could reach out to my staff, be happy to help with that, Blanca. I don't know how to get her
Can I ask a
contact
question?
information.
Yes.
So assuming that you guys make it through the pilot and you scale up, then you're going to have more promotoras, right? And so asking for a friend, if you're bilingual but you're undocumented, would it still make sense for you to be able to apply for something like that, or no?
Right now, because our contract is with the county, we probably couldn't hire someone that's undocumented. We'll have to check into that. We're gonna need a lot of people. The county is right now responsible for contact tracing. I actually think that it shouldn't be done by the county. It should be done by the local agencies that are actually on the ground and know the families. So there is a conversation going around that. Can community organizations support the contact tracing? And so we might need more staff. I don't have a straight answer to you. Right now, with the contract we have with the county, it might be difficult to hire someone that's undocumented. We've been creative at finding ways to support and compensate people with stipends. So there is opportunities for us to do something like that, because we know the need is huge.
Thank you.
All right, thank you. Reymundo, you're on.
Yeah, this is Reymundo. I'm the CEO of Gardner House Service, and thank you for allowing me to speak with you tonight. Just to say the same thing, I think that Nora and Veronica are saying. There's a great big need. If you look at the impact, I think at least because we have services at our health centers, and we've noticed that the rate of people testing positive is 3 times higher than the average in the county. And it's all about, the majority are Latinos, right? Latinx, Chicanos, Latinos, Mexicanos, undocumented, documented, so I felt it was really important, and I really appreciate the collaboration with the five organizations, including the Community Health Partnership and everyone to try to get the word out and try to get people tested. You know, we worked a deal with the county and the School of Arts and Culture and the 5 organizations that we talked about in the colectiva to try to get people tested, and it's very, 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 very important. You know, we're hearing things like I'm glad to hear what the interviews that were conducted, because it does talk about, you know, why people aren't testing, and we really need to get the word out. I've heard some things like, for example, individuals don't want to be tested because if they are, they don't have options for isolation or you know, options for you know, getting additional financial support. And I think from what I've heard that the county has, if you do test positive, they will provide, if you qualify, again, it's a qualification issue, you know, potential housing to isolate, and potential, you know, depending on the situation, some limited amount of funding from what I hear. But again, I think it's really important to get tested, and just to reiterate, we've had 2 sessions, and the first session we saw 144 individuals that were tested. The second one was 188.
Wake me when they get.
Yeah. And we're able to test up to 300 or more individuals.
No.
And so you know, we're there for the community, and we need to get the word out, and anything that you can do to do that would be great. We're, again, to reiterate, we're every Wednesday from 1 to 7 p.m. at the Mexican Heritage Plaza. We do we're trying to be really efficient and keep the social distancing so that people are aware that we're doing that. And again, this is a really crucial, and I think the outreach hopefully will help us get more people involved and understand that this is very real. I think that's been the biggest challenge for us. We wanted to go to the Mexican Heritage Plaza because we felt that it was probably the safest place for people to receive a test, and that's why we implemented it. On the other hand, with regards, I didn't understand the previous question, but I know that Gardner Health Services, we have our facility we have several facilities. We have 7 sites, but the one closest to the east side is 3030 Alum Rock, and we do take anybody regardless of ability to pay, even if they're undocumented. You know, we don't take social security information or anything. It's a sliding scale. And we provide all kinds of services. In fact, out of the 40,000 people that we see, 10,000 are uninsured, mostly undocumented. So, and we provide medical, dental, optometry, pharmacy, and healthcare to the homeless services. So, even chiropractic services. So I wanted to, let you know that hopefully, don't let being undocumented not get you help, right? Go to the clinic.
Okay, any questions for Reymundo? Go ahead and raise your hand and I'll let you ask the question. In the meantime, where are all the testing sites in the east side? I know there's the one that you just mentioned, Reymundo, but I know on Alum Rock, next to James Lick, there was a site. I don't know if that's still available or not, but I don't know if anybody knows where all the testing sites are located.
I don't have that at this point, and some of them are like pop-up testing sites. They may not be there all the time, so they're frequent. It's they just pop up and they say, "Here, we're going to be here."
If people call 211, 211 will give 211 is getting updated information on all the sites. So right now there's about 50 sites in Santa Clara County that are offering testing. And so for our project, we're pushing people to go to the plaza. But if people need to get tested, they need to get tested and they need to go somewhere. So calling 211 to get the closest site and the one that's available. it's important, so that people should do that. But we do also have a list, so I don't know if we can send it to someone and you can distribute. I don't know, Reymundo, you probably have more information than we do.
No, I think, well, I can get it, definitely. And I can send it to someone, I guess. Who could I send it to?
You could send it to me. My email address. You want me to just give it to you right now? You want to write it down, or?
Yeah, let me get a pen.
I
So
just
just
tried
to
to put the URL for the county's testing site into the chat, but I don't see chat, and I couldn't put it in the Q&A. But if people just Google Santa Clara County Department of Public Health, there's a whole line of links on the right side, and one of them is the coronavirus testing. And I think that pretty much every week for like the last month, the pop-up testing site has been at Overfelt High School. And that's where it is this week as well, through Friday.
So
Okay,
the testing at the Mexican Heritage Plaza, I just want to say it again. It's from 1 to 7 every Wednesday. No cost. You don't have to make an appointment. You just walk in. You can come at 9:30 in the morning, and they'll give you a band with a time, so you don't have to wait in line. And then you come back your time and get tested. But no cost. Anyone, regardless of your status. And I think that the whole, and I think grassroots outreach is because it's important to have individuals that know the community, that understand the needs of the community, and be able to have a one-on-one conversation so that people can get all the information they need and feel secure and confident that when they go get tested, that's a safe environment. So it is a goal to be able to test everyone that needs to be tested so that we can reduce the number of cases in the 4 zip codes.
You know, one other thing just I wanted to share is that one of the things that we discovered as we were training the promotoras is that a lot of residents in the community do not have face masks or, you know, so part of the project will be to distribute PPE to the community. And so we're going to start doing that, I believe it's next week. So if you see people in the community giving away masks, that's what it is. I mean, you know, a lot of people have a judgment about the community saying they don't care, they don't get it. I think a lot of people get it, and a lot of people don't have the masks. So we want to make sure that they're in their hands so that people can start wearing the masks and protecting themselves and protecting other people. We will be in partnership with the School of Arts and Culture. We will be launching a media campaign using some messaging that's going to go out to community as well, with some of the same messages of preventative measures. What can you do? When to get tested? What is contact tracing? You know, why should you get tested? Who gets the virus? Who doesn't get it? And you know, and all the things that we train them on. The public health department provided us with a lot of information that we passed on to the promotora. So I think they're pretty well equipped to do the job and to go out in the community and really make the case not just for testing, but for all of the other concepts that are important, you know, how to prevent it, you know, when to answer that contact tracing number. That's really important for the county, that when they get that phone call that's coming from a 916 area code or says COVID team, that they answer the phone I mean, again, in the community, a lot of people are scared of answering the phone calls, but that's another role of the promotoras, is to go out in the community and tell them what questions they're going to ask them, why they're calling, and what are they not going to ask them. They're not going to ask their immigration status. They're not going to ask about their financial, information. So again, I mean, it's great that the residents that are listening today are aware that this is happening, and that we are trying to get this information to as many people as possible.
Fantastic. Okay, Reymundo, my email is
Okay.
V as in Victor, V as in Victor, P as in Paul. So it's VVP at my first and last name, GustavoGonzalez.net.
Davo Gonzalez.
.net, N-E-T.
Okay. I'll probably try to, I'm out of town right now, but I'll try to get it. And you want the locations, right?
Yeah, if it's on this county website, I could just pull it up myself.
Okay.
And send it to Juan, and he could send it to everybody else. So I
Okay.
think
Great.
we're okay. Don't worry about it, Reymundo. I'll find it.
All right.
Okay.
Thank you so much.
So